Miss Doris. Welcome.
Oh,
Thank you for being here with us today. You know, we always enjoy hearing from the Central Florida Behavioral Health Network. And today you're going to share some more info about what families can do to help prevent substance abuse, particularly with our kids.
yes, thank you very much for having me on again today, Queen. You know, fall is now in the air, even in Florida, and we can anticipate lots of school activities, family activities, sleepovers, study days, and holiday celebrations, to name a few, in the coming months. There may be times where our young people might encounter alcohol or other substances when they're socializing with their friends and in new surroundings. They need to know what they should do if they're offered substances. How do they safely decline? And should they even safely decline? If you've had the talk with your children, they will know how to keep themselves safe should a situation occur. The best way to prepare them is to have an ongoing and frequent talk with them about why alcohol and substances are not for them. And not only that, but give them some real life examples of how to decline, to safely say no, or have some other alternatives to fall back on if they find themselves in a situation they feel uncomfortable. Our Talk They Hear You campaign works to get the message out to parents and caregivers about having these critical talks with their kids. We've added information and links to our website that parents can access. And if you want more in-depth information about your own communities and how you may even be able to get involved if you're so inclined, visit our prevention partners and our coalition pages on our website as well.
All right. Now, you also want to mention something that came about new this year for all of us. The number is 988.
Yes, Queen, I think this is good information to put out now. The Suicide and Crisis Lifeline launched a new 3-digit number July 15th. This is across the entire nation, and this number can be used for talk and text. And there is an option to access the chat at 988lifeline.org. The Lifeline is a national number, as I said, and it does connect people when you call in to local resources. It's available 24/7, and we are also partnering with SAMHSA to communicate life-saving tips with the Be the One To campaign. There are 5 steps that anyone can take to help someone who is in crisis for mental health or substance misuse issues and is thinking suicide is the only option they now have. It isn't. These 5 steps are available on our website, www.cfbhn.org. And it's good for your kids to know. It's good for you to know, so that you come into contact with anyone or your kids come in contact with anyone, because actually young people is one of the largest populations that do think about and do actively engage in suicidal thoughts and behavior.
988. That's very important to know. Thank you so much for sharing with that. Also, could you have any last words for our parents?
Yes, just remember, all of your listeners, parents, caregivers, our young people that may be viewing and listening, that we are in it to win it with you. We want to make sure that you grow up healthy and happy and are successful. Learn more about what you can do to keep your kids in safe and healthy, parents. Visit our website, www.cfbhn.org. Download useful information to have the talk with your kids. And remember the new 988 number. Very easy to remember, just 3 digits.
That's right, 988. Remember that number. Also, for any info you need, just go to chbfn.org and check it out. It's a lot of great info. Talk. They hear you.
Yes. Very much.
Thank you, Ms. Doris.
Thank you.